The nearby Marion, Illinois VA Medical Center just received 4 out of 5 stars from the Centers for Medicare and Medicaid Services annual overall hospital quality star ratings.
Joining us now this morning is Dr. Sharif El-Naha, Undersecretary for Health at the Veterans Health Administration. Good morning.
Thank you so much for having me.
Yeah, glad that you're with us this morning, Doctor. First off, let's talk about the star rating and why it is so important to this hospital, and any hospital really, but more so this hospital very close to our viewers.
That's right. The Marion, Illinois VA Medical Center, I'm proud to say, is one of our top scoring VAs across the country. And for the first time, just a month ago, the federal government released star ratings for every hospital in the country, not just VA, and veterans can now compare VA medical centers to other options they may have in the community. And so across the country, 67% of VA medical centers soar in the top 2 ratings, 4 or 5 stars out of 5. And we're really proud that Marion VA is one of our 5-star medical centers.
Why is VA care the best choice for veterans?
The most important reason is our workforce. More than a third of our workforce are veterans themselves, and so many more people on our teams have a veteran in their lives and really consider the mission to be personal. We also have some of the best clinicians in the country. We're connected to so many medical schools, the vast majority of the best healthcare institutions that train professionals. And so a lot of them come into the VA. And so you have a combination of people who care about veterans and think about veteran care every day, and just world-class clinicians in our system.
So, Dr. El-Naha, let's talk more about this data here that was just recently released. What does that say about VA care? Because it sounds like it's fantastic news for our VA centers.
That's right. So the rating is pretty comprehensive. It looks at quality and patient safety outcomes when veterans are admitted to the hospitals at VA versus the community. It also looks at patient experience surveys. We send surveys to every veteran who's hospitalized in our medical center, as do civilian hospitals, and a number of other components like how often we have to readmit veterans if they come in for care. And overall, we score extremely well in almost every domain, better than, on average, than the private sector. And so we're really confident and hope that veterans can increase their trust in us for our care, because we know that their outcomes are better when they do.
Now, what are some ways the VA achieves and maintains high quality care for veterans?
We focus, first of all, on really robust training to make sure that the veteran experience is prioritized. That's a pretty easy one because so many people in our system take the mission personally. We also have a lot of processes in place to make sure we're measuring outcomes, responding to them, and that leaders are connecting directly with frontline employees to hear about their concerns around the environment of care. That's an initiative we have called High Reliability. So we're really proud of our results because of both our people and our systems and processes.
And of course, this is great information to share, Dr. El-Naha, but what is really the importance of sharing this data across the entire nation?
Well, veterans can be confident to know that in the vast majority of VA medical centers, they're less likely to experience an adverse event, medical errors, than other options in the civilian sector. There's also study after study that shows that VA is at least as good, if not better, in so many other dimensions of care that you can get in your clinic, specialty care, mental health. And so we're really proud of these outcomes and hope that more and more veterans can trust us with their care.
Thank you very much for your time today and sharing that good news with us so close to where we are right here in the Tri-State. Appreciate your time.
My pleasure.